Hello, my name is Ashley Swalker, and I'm going to be teaching BLS to Jessica Schaefer here, who has graciously allowed me to record us for our session today. So thank you, Jess, for this. Much appreciated. Are you ready? Okay. So I don't think you'll need it, but if you do need any resources, there's a BLS book here, and I also have one of the little cards back here if you need anything. But let's just go ahead and get started here. Let's kind of like talk about the mannequin. This mannequin is, feel free to have a seat. He's equipped with some special technology that identifies how fast your pace is, that you're going within the rate that you're supposed to be, which is 100 to 120, and the correct depth, which is?
Jesus.
Perfect. So if we're doing CPR and it's sensing that you're going too fast, it's going to give you like a little lighted warning sign. If you're going perfect, which I'm sure you will, you'll see 2 green dots, so that you'll know that you're going at the correct depth and speed. So we'll practice that first. Let me just kind of show you, and so you can kind of see what 2 inches looks like. Jess is a nurse in the ICU, so she's very well aware of how to do chest compressions, but let's go ahead with this mannequin. So, you're going to do hand over fist, straight over, and just push down. So you can see the 2 green dots. And that's basically, if you're doing that, if you see 2 green dots, you're going at the correct depth. So let's go ahead and have you give it a try.
Got it.
Yep. Perfect. You've definitely done CPR before, so very good. So we'll kind of go through a scenario once we do some bag mask ventilation. So you'll be able to practice that more, but you did great for this part. And then I just wanted to show you sort of how to bag mask ventilate. When we're doing our test together today, you don't need to do mouth to mouth or anything like that. And you work in healthcare, so most of the situations you'll be in, you'll have a bag mask. But if you're out in the field, use your discretion in terms of if it's family or friends, whether you would want to do mouth-to-mouth resuscitation. The AHA usually wants you to use some sort of a barrier device, and at the end of the class today, I'll give you your own, barrier device, so you can carry that in a little keychain. That way you're always prepared. So, but for the sake of our class today, when you're practicing, if we're doing a 1-to-1, you're going to just pretend to blow into his mouth. Okay, so you'll kind of just, your head tilt, and lift here. So head tilt, chin lift, and you'll just, that way I know. Okay, and then if you're doing bag mask ventilation, sometimes it's a little bit more difficult to use a mannequin for bag mask ventilation than it is a real person. But let's see if we can get this started for us. So kind of want to angle yourself at a good angle so that you can see the chest rise. And head tilt, chin lift. You're going to do your EC with your fingers, and just kind of wrap your fingers around the mask like this. Put it around the bridge of the nose, and then you're going to seal it and kind of bring your pinky finger on the chin to bring his head back. And that should give you a pretty good seal. And you'd want to listen for any leaks, okay? So I'm having a little bit of a leak here, but this is also not inflating great, so let me just play with this a little bit here. Okay. It's in my car, so it might be a little bit deflated, but so kind of stretch that around and get a good seal. Took the chin back, and there you go. Looking for chest rise. Okay. Do you want to give it a go? Now, are you right-handed? Okay. Even left-handers tend to use their left hand with the mask and right hand with squeezing. That's pretty much the technical way to do it. I know, it kind of is deflated from being in the car. Okay. Good. That's perfect, yeah. There you go. Oh, you actually got it on the first Wow, you got it on the first try. So very good, yeah. Excellent. So that's pretty good. I think we're ready to go for the scenarios if you are.
Yep.
Okay, so, excuse me. I'm gonna take a quick drink. So let's pretend that you are out taking a walk in your neighborhood. And you're just walking through a park, and you see a gentleman in front of you who's walking, but he's sort of clenching his chest. And you see him and you're like, ooh, he doesn't look so good. What would you do?
Ask him if he's okay.
Perfect, yeah. So he's kind of just like, oh, no, it hurts.
Help him to the ground.
Perfect. So, yeah, exactly. So you'll help him to the ground, and we'll say, this is our gentleman. He just lands to the ground. And now all of a sudden his eyes are closed.
I'd want to check for a pulse,
Okay.
if he's breathing.
Perfect. Where would you check for a pulse?
I would check his neck.
Yeah, perfect. Hooks carotid pulse.
Yeah.
So go ahead and check that. We'll say you don't think you feel anything.
Okay. So I'd call for help
Yes, perfect.
and then start CPR.
Wonderful. So if you're out in a park and you saw somebody, you could say, hey, you, like, can you come help? But let's pretend you don't really see anybody else out in the park with you.
Okay. I could just have my phone call. Hey
Perfect.
Siri, call for help.
Perfect. Yes. Yes. Wonderful. Yeah, and that will usually work. And then just keep your phone on speakerphone. And EMT 911 will be on the phone with you, and they'll talk you through everything. But we'll say, okay, you call 911. You notice that he doesn't have a pulse. Is he breathing?
No.
Nope, no breathing. Okay, so let's go ahead.
Do you want me to count?
Sure, 8, 9, 10.
11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And I
Perfect.
get 2 breaths.
Perfect. And you did the head tilt chin lift, so that was great. Wonderful. Okay. So you can continue on, and now we'll say you see somebody walking by, and
I could ask them if they knew where an AED was.
wonderful. Okay. So we'll just say, oh, I happen to have an AED in the back of my car. Let me go grab it for you. All right. So we'll continue CPR, and I'll bring you the AED. And make sure you're keeping the number in your head. Doing great. A little deeper, I think. Perfect. Excellent. Okay, so here comes the AED. And then you can give us 2 breaths while hopefully your other person can help you to put the AED on. But you can continue CPR. You never want to stop with the compressions while someone's, if you can, they can put the leads on while you are doing compressions. Now, most AEDs are very easy to recognize on the pictures. It'll tell you where. So we'll have you put the last one on. You can take a look at the picture there and see. Good. And then once it's on, the first thing you'll do is
Turn it on.
Yep.
Adult patient.
Good.
If the patient is a child, press the child button.
And I'll just continue CPR while you're listening.
Apply pads as shown in the pictures. Apply pads as shown in the pictures.
You might have to apply them a little bit
Press
tighter.
pads firmly on skin. Apply pads as shown in the picture. Press pads firmly on skin.
Okay.
Do not touch the patient. Analyzing heart rhythm. Do not touch
Oh,
the
it
patient.
seems like a really long
Analyzing heart
time
rhythm.
while it's analyzing.
Shock advised. Do not touch the patient. Everyone clear.
So you'll
Press
say all
the
clear.
flashing shock
All
button.
clear.
Good.
Press
Now
the shock button.
And then
Shock delivered.
Perfect.
Begin CPR.
Awesome.
10,
Good work.
20,
A little bit deeper.
30. Give 2 breaths.
Perfect. So, Jessica, you did excellent. I think you can stop there. I know it gets tiring.
Yeah.
So, the biggest thing with CPR is deep. You really want to do really deep, 2 inches. That way, that allows for the heart to refill back up like a sponge. So that heart refills when you squish it down with a compression. All that blood's going to go and perfuse the body. So when you're getting tired, just think you got to let that heart refill. It's better to go hard and fast than shallow and even more fast. So, but good job. So, yeah, that was excellent. And I know that's kind of odd because we're typically working one-on-one with each other in the healthcare field. So our next scenario will be something more so along the lines of we'll pretend that we can't really be in the ICU because that would be ACLS, but let's just pretend that we're maybe at the gym together. Okay, so you and I went to the gym together and we're walking to go get a drink at the drinking fountain, and you see someone laying down on the ground. Okay, so we'll just kind of do that sort of a scenario, and we'll just pretend that the 2 of us are together and we know that we both know CPR, so we'll kind of work as a 2-person rescue. Okay. So here's a gentleman laying on the ground here. What would you do?
Check for a pulse, they're breathing, call for help.
Perfect.
Well,
And-
I'd probably ask you to call for help.
Perfect, and I'll be like, oh, I know where the AED is. How about I go get the AED, you start compressions? Or does he have a pulse?
No.
Okay, so you'll start compressions and then I quickly come over with the AED and I'll have you kind of set this up this time. Okay, and I'll continue.
Adult patient. If the patient is a child, press the child button. Do not touch the patient. Analyzing heart rhythm.
Good. We're clear.
Do not touch the patient. Analyzing heart rhythm.
And I can do
Shock
press this time.
advised. Do not touch the patient. Everyone clear. Press the flashing shock button.
All clear?
All clear.
Shock delivered. Begin CPR. 10. 20.
Perfect. You're doing really good questions.
30. Give 2 breaths.
Excellent.
10.
Okay. Wow, nice job. So, yeah, that was great. So that's 2-person, and we would continue that until EMS arrives. And I don't know if you remember how many minutes you would want to do CPR before switching.
I would think 2 minutes.
Perfect. Yeah.
I'd be pretty tired.
Excellent. So yeah, 2 minutes is the standard. But also, if you're starting to get tired, or if I'm starting to get tired, then you just say, let's switch. And it's always a good idea to switch when the AED is like checking out for a rhythm, because I think it's sort of set, to do that at 2 minutes. But if you're starting to get tired, you just switch, because that's the most important part. But yeah, nice job. So are you ready for the test? It's quite simple. I have it all set up here for you. It's just a paper test, and you kind of just go through. Do me a favor, don't write on the, oh, thank you. Don't write on the test questions. Just write on the answer sheet. Yeah. If you could put today's date on there, and then which version, I believe it's version C.
Yeah.
So, okay, good. Thanks, nice job. And then when you're done, just let me know. I'm gonna step out for a minute, and then we'll go over everything together.
Okay.
All right.